As Uganda continues to grapple with the surge in chronic illness, a local health startup is offering an unconventional but increasingly promising model, one that replaces brief hospital visits with long-term healing through wellness coaching. Dr. Hachine Yacoub, a medical doctor and co-founder of Vigilant Living, says the idea for the initiative was born nearly a decade ago while he was still a medical student at Kampala International University.
We were really amazed by the level of chronic diseases. Diseases like diabetes, hypertension, heart disease, cancers were increasing. That was almost 7 to 9 years ago when I was at medical school in KU. So we really wanted to make difference. And
together with a classmate and driven by a shared passion for digital health, the duo launched the company after internship. Their initial project was an electronic medical record system, but they later pivoted to health and wellness coaching after recognizing that systemic change would require more than just data management.
Just because someone has issues with the kidney does not mean that they are a kidney disease. People have complex reasons, and that's why we get these non-communicable diseases.
He explained that poor or unhealthy diet, sedentary lifestyles, smoking, and alcohol abuse are the 4 major risk factors driving non-communicable diseases. Additional contributors include chronic stress, poor sleep habits, and limited social engagement. The need for such a solution is urgent. An estimated 2.7 million Ugandans are living with diabetes, yet 80% of them are unaware of their condition, and only 4% are receiving treatment. In addition, over 5 million Ugandans live with heart disease, according to data shared by the organization. Meanwhile, 28% of children in Kampala are obese, largely due to poor dietary habits and lack of physical activity. Mental health is no exception. More than 30% of Ugandans are currently living with at least one mental disorder, including substance addiction and suicidal thoughts, says Dr. Yacoub, citing both his organization's outreach findings and national trends. These chronic conditions are also cited as a leading cause of debt, bankruptcy, and reduced productivity in Uganda's workforce. Most health centers at level 3s and 4s still lack basic diagnostic machines, laboratories, and machines for NCDs.
People only get aware of it when they have complications, whether when someone gets blindness, kidney issues, kidney failure, diabetic foot where someone has to be amputated. Same thing with hypertension.
Health coaching, the company's chosen tool, tackles the problem from the ground up. Certified coaches work with clients to set realistic goals, such as carving out working time for a civil servant or introducing fruit-only meals into a tight family budget, and then keep them accountable over months, not minutes.
It's because lifestyle change is not just something you instruct, it is a psychological issue which has to be changed. And even on top of that, there are also social dynamics. So a health and wellness coach is a healthcare professional who understands that psychological tools and who often listens to the client first, not just tells them what to do. So they first get information from the client, the patient, and then they use that information to personalize the treatment.
Affordability is also central to the approach. Memberships cost between $3.50 and $10 a month, and health coaches receive 1/3 of each subscription as payment. The organization reports that clients typically remain subscribed for at least 6 months, and that 90% of new customers come through referrals. With each coach managing around 30 clients, Vigilant Living has recorded a consistent 10% monthly growth rate in enrollments between August 2024 and March 2025. The business is also tapping into the corporate market. Small and medium-sized enterprises, SMEs, which account for 90% of Uganda's private sector and employ more than 2.5 million people, often lack affordable wellness plans. In fact, Only 500,000 Ugandans, roughly 0.5% of the population, currently have medical insurance, most of whom are executives in multinational firms. Meanwhile, out-of-pocket health expenditure in Uganda remains high, standing at 31.25%, with government funding accounting for only 22.53% and insurance a mere 3.11% of health spending.
Less than 1% of Ugandans are insured, meaning that majority of Ugandans pay out of pocket for their healthcare services. And the bad thing about these non-communicable diseases is that they are chronic, so they either lead to bankruptcy or even death.
To change this, Vigilant Living is working with the Insurance Regulatory Authority of Uganda to create new insurance models that reward healthy behaviors.
I met a lady who told me how she was given a 50% discount when she came from South Africa to Uganda just because of how she got points for being physically active and doing other lifestyle changes. So that is what we are trying to do, and that's a model which we will replicate and scale all over East Africa and other African countries.
The long-term goal is to provide affordable technology-supported coaching for both insured and uninsured populations across Africa. Uganda currently spends 4.67% of its GDP and 4.88% of its total domestic budget on health, yet chronic illness continues to be the leading cause of death. The Ministry of Health's strategic plan includes a target to reduce premature deaths from non-communicable diseases by 1/3 in the next decade. These diseases kill people in their 30s and 40 years.
Vigilant Living, and our purpose is to increase longevity, living long, productivity within the community as well as organizations, and lastly, meaning, whereby people find meaning and satisfaction with their lives.
Namono for Science Television News.